What influences does transcranial direct current stimulation, or tDCS, have on major depressive disorder? What are tDCS? tDCS refers to a non-invasive transportable neuromodulator device that sends a small positive or negative electric current directly to the scalp. The electrodes are positioned on the scalp in a way to influence where in the brain currents flow and how. They are not capable of activating an action potential, and instead, they influence a neuron's activity in a desired direction. In this case, they are used to influence individuals with major depressive disorder, or MDD, by promoting the hyperpolarization or depolarization of neurons. What is major depressive disorder? MDD refers to a mental disorder, also known as clinical depression, which is characterized most likely by the disruption of neurotransmitter function and chemical imbalances of serotonin and dopamine, amongst many other processes. Depression usually interrupts one's ability to function as usual in all aspects of life. It is predicted to be the second most disabling condition by the year 2020. So how did tDCS influence major depressive disorder? Brunoni and co-authors investigated the use of tDCS for the treatment of MDD. Studies researching treatments for depression have revealed that whilst treatment options such as antidepressants prove effective, they lead to a range of side effects, including sexual dysfunction and weight gain, that often cause treatment discontinuation. Almost 80% of patients experience a relapse after an antidepressant treatment. Extensive research has been conducted exploring tDCS over the past 10 years and has provided favorable findings. They have a low report rate of adverse side effects, which increases the probability of treatment maintenance. For the treatment of MDD using tDCS, one anode is positioned on the area corresponding to the left dorsolateral prefrontal cortex. The current flows from the positive pole to the negative, causing areas of the brain close to the positive pole to become hypopolarized, and those near the negative to become hyperpolarized. The neural system hypothesis is the hypothesis explaining MDD, which understands that depression relates to inhibited cortical and subcortical areas. Thus, tDCS regulates these areas via modulation. Fregni and co-workers first discovered the antidepressant properties of tDCS through a randomized trial and their usefulness for treating depression. Therefore, Brunoni's research highlighted the neuromodulatory effects of tDCS. A study conducted by Liu and co-workers confirmed the antidepressant effects of tDCS, with participants with MDD showing significant improvement. Results indicated improvement for mood, attention, and working memory after treatment. Palm and co-authors discuss the complex psychological mechanism of tDCS, stating that they move resting neuron potentials towards depolarization following excitatory stimulation and moves them towards hyperpolarization following inhibitory stimulation. The effects of tDCS can last up to 1.5 hours after treatment, which may influence the patient's likelihood to continue treatment. Studies have revealed structural and functional neurological changes in the depressed patients in several areas, including the amygdala and hippocampus. Furthermore, tDCS have shown to normalize brain activity, which aids in the treatment of depression. Studies have not investigated the effects of tDCS on MDD independent of other pharmacological drugs, especially antidepressants, making it a limited understanding of the independent effects of tDCS. Research needs to be conducted investigating the effects of various drug therapies on tDCS, as some may extinguish its effects. This would allow tDCS to be studied independently. Additionally, patients receiving tDCS treatment must travel to their treatment facility on a regular basis, which may impact the probability of the patient maintaining treatment. Due to its portable nature, they could potentially be conducted at home by training the patient on how to use it safely and correctly.